Can you briefly introduce yourself and your experience with laser device and dermatology? What is your background? What inspired you?
My background is scientist. I have two masters, one in biology with specialization in endocrinology, and another one in sport science, but for other reason. So my experience now is 20 years and more of work in the field of medical devices in terms of beauty treatment, aesthetics or normal beauty, and pain management. So in my last 20 years, I worked close with the industry of devices, creating new device, teaching other people all around the world. Now I'm based here in UK, but before I was traveling across the world. I've been in Japan, America, China, Russia, Thailand, everywhere to or present new technologies or to teach others how to use the technologies.
How has the laser technology evolved in dermatology over the past decade?
But the evolution of the technology was very strong. So in terms of quality of the devices and the quality of the treatment in itself. This means that all we know that when we approach the skin, we need to have the right quantity of energy to use it. Because despite a lot of people think that more energy is better to have better a quick result, certain time is not going the same way of the, for example, anti-aging effect. So in the last decades, all the technology mainly are involved to generate less side effect and more effect. But technology in itself is not enough certain time, because parallel of this, you need to know how to use it, otherwise it's useless.
What are the most common dermatological conditions treated with lasers today?
But depends on the situation. For example, aging process of the skin, keratosis, or other kind of small things coming out from the skin, or sun damage, for example, in terms of blemishes or hyperpigmentation, arriving to the scars, so post-injury scars or post-surgery scars, or scars coming from tattoo removal or other kind of procedure when the laser is not well used and the approach is not the right things, not use the right things to have the better result. So of course, depending to the situation, so we can have different kind of treatment that we can do with the lasers, starting from the blemishes of the skin, so hyperpigmentation or melasma or chloasma in terms of hormonal disease or other kind of situation.
What are one of the main reasons that tattoos get scarred or not properly removed?
There are different reasons for this. One can be type of technology. So, for example, all the technologies like nano, YAG lasers compared with new technology, picosecond laser technologies. Another can be the skill of the people that is using the laser and the lack of knowledge that sometimes happen. So in terms of the side effect, now we know that a very important part of the procedure is the time of the relaxation of the skin. This means that the time of relaxation is the time that describes in how many time in terms of seconds the skin can come back after treated by the laser and increase the temperature. The skin is able to reduce the temperature and come back to the normal level. Okay? If we increase too much the time of the exposure of the skin, the temperature will be very high, and the risk to destroy the epidermal layer, so the superficial layer of the skin, is very high. when we destroy the epidermal layer and we show the dermis to the hair, the risk of the scarring is very high. With the picosecond laser or new generation of picosecond laser, because the release of energy is very quick, they are able to have less impact in the epidermal layer and target better and more the ink inside the dermis layer. This is from the technical side of the lasers. The other side, of course, is the knowledge and the skill of who use the laser, because you have to know how many energy to use, how frequently, and you have to know how to treat the different type of skin, following the Fitzpatrick scale or following, for example, the pathologic condition of the people, also of the person. Certain time we have to treat person with immune disease, or we have to treat people with certain kind of a condition, eczema or psoriasis, so certain condition that can make the skin more sensitive, and all these kind of things you have to be considered when you approach the treatment.
Is there any possibility to decrease the scarring or potentially completely remove it?
It's possible to treat with, for example, resurfacing lasers, or even with fractional radiofrequency, so all the technology that are able to resurface the skin. The completely resolve of the problem depends on the level of the damage. Of course, more deep is the scar, more difficult will be the solution of the problem, because when we have scar, the type of collagen involved is the type 1, is a fibrotic collagen. This kind of collagen is developed from the body in a dangerous situation. Why? Because there is an injury, there is something that is not normal, and the body have to close soon as possible the open wounds, for example. Why? Because the first reason, because we are having the skin, is to protect the body from the bacteria and virus, okay? But the problem of the collagen type 1 is that when he closes the skin, he is not following the normal structure of the skin. He closes everything in a chaotic manner, so the fiber go one up each other for to close soon as possible. And with the structure of the skin, then to come back to the normal situation is easy. We need to resurface a lot before to rehab skin very close to the normal. We can treat all kind of scar. Of course, again, you need to consider the situation where you have hypertrophic scar, for example. That means that the scars are a little bit bumpy, red, and little bit erased, or situation where when you have keloids, that is another condition where you have high level of intensity of fibroblasts. So in that case, you need to be very, very careful and leave the treatment to the doctor that are specialized for them.
Thank you. You mentioned earlier that you work on the pain management side a lot. So
Yeah.
how do you manage pain and the side effects, for example, blistering, scarrings, and patients undergoing laser treatments?
Okay, of course. The first step is to understand the situation. So, for example, we know that tattoos with high density of color or tattoo with a lot of colors, tattoo localized in the lower legs are more prone of blistering. So knowing this, we can arrange for example, the energy and split the session in 2 times to try to not increase too much the inflammation. This is the first, like a prevention. But unfortunately, blister can happen because it's a part of the procedure. So when the blister happens, I have not to be worried because something that can happen. And to be honest, is an inflammatory reaction of body. So Blisters are fine until they are closed, because there is no risk of infection. The most important thing is to not pop up, and in case they pop, disinfect, in case treat with a little bit of antibiotic and cover with gauze. But the normal recommendation after the lasering is to apply cream for example, burned skin. There are different brands we can find in the pharmacy. This at least for 5-6 days after the treatment, and then carry on with the moisturizing cream and keep well hydrated all the skin.
Do you see non-laser alternatives like RF or ultrasound competing with laser technology in the future, or even now?
To be honest, I have an holistic approach to the treatment, probably because my knowledge is very large in terms of type of technologies. Certain time I used to combine different kind of technology. I'm not using only with the laser. So, for example, radiofrequency, different kind of radiofrequency can be radiofrequency with needling or without needling, can be radiofrequency only applied on the surface of the skin, or can be radiofrequency that can create a little bit of burning on the surface. So there are different technology you can combine together to have the better result. Because at the end, with a laser, generally, we work on the surface of the skin. And in case we can stimulate indirectly certain reaction in the dermis layer. But other kind of technology, like for example ultrasounds, radiofrequency, or even mechanical vibration, you can interact with the receptor of the dermis layer, having other kind of effect. So when we think to approach a treatment of the skin, it's impossible to think the skin like one layer. The skin is a complex tissue where we have different layer, and in different layer we have different receptor. So starting from this point of view, we know that treating the different kind of receptor and tissue with different technology can make the situation better.
Where do you think, what innovations in laser technology do you anticipate will revolutionize dermatology in the next 5 to 10 years?
A big impact can be done by, for example, the artificial intelligence in terms of help the practitioner to have a good diagnosis of the skin, of the blemishes, and help to project the protocol for the treatment. Another thing is probably going forward we will understand better that with the skin it's better to use mild approach in terms of anti-aging process compared with little bit strong and intense stimulation, because again, when we develop free radicals into the body, is like an aging process we are starting, and we need to be careful to not increase too much. Otherwise, instead to have anti-aging effect, we will have pro-aging effect. So probably in the future we will get a little more conscious of this, and the treatment will become less invasive in terms of energy usage, but maybe more targeted.
For the patients, if they're looking for a clinic and they're obviously not close to you in London, what kind of signs should they look out for when they book their next laser or treatment appointment?
If the people in front of them are having enough knowledge to the treatment or not. They have to feel confidence. Now everyone can buy a device, everyone can have a training course. So probably the most important thing is to understand if the person in front of you are having enough knowledge is to put a lot of questions. Because again, here, specifically here in UK, where the situation is a little bit different compared to Europe, not only the doctor can use certain device, like for example, tattoo lasers. Money, certain time, not easy to find, but not base the decision on money situation. Because like for everything, when the treatment or the things is very cheap or more cheap than the others, there is a reason, not because they want to be more cheaper, but probably because behind the technology is not enough good, and the people also, they not spend a lot of time in terms of studying. So when you pay something, it's not paying only for the treatment, you are paying for the experience, for the knowledge.
Any last words for anybody watching?
Beauty treatment now is very huge market. The only things, remember that the body is not projected for to have this kind of effect. So be careful to not to push too much, because otherwise instead to have again an anti-aging process or rejuvenation or biostimulation, you will have the speed up of the aging process. Okay, so not target for quick and easy result, because certain time the skin need time to react, and that's it.
Thank you very much.